Hey, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the rectus abdominis muscle. Your rectus abdominis goes from your xyphoid process, the bottom of the sternum, attaches along the costal cartilages of the ribs 5 through 7, and is going to follow down into the crest of the pubic bone. And it's going to run along the front side of the abdominal cavity. It's attached to different muscle groups on each side, through the top, through the back side. It will have a connection to both the diaphragm for breathing as well as your pelvic floor. So it's going to contribute to a lot of tension on other areas of the body as well. So fascia is the connective tissue that wraps around the muscle. And the muscle itself can develop areas that are overcontracted, and we call those trigger points. So we're going to do both a myofascial and trigger point release of the rectus abdominis. And if you have trigger points in this muscle, you can end up developing pain that goes across the mid-back or even across the low back. So if you're having pain in your mid-back or your low back just above the belt line, sometimes it can be from trigger points in the front side of the body in the rectus abdominal muscle. And how do you develop these trigger points can be from overuse of the muscle. So if you're doing a lot of abdominal work, or if you strain using your abdominals, you can end up having areas of overcontraction, developing the trigger points. If you have visceral disease, so if there's problems in your organs, then it can show up in the rectus abdominal muscle. If you have paradoxical breathing, so if you are breathing in and your abdominals are going in and then exhaling, your belly's coming out. So that can develop trigger points in the rectus abdominal muscle, or if you've had any surgery where you have scar tissue in that abdominal region, you can end up developing trigger points in that muscle. And it's going to run long way. So it's kind of like the turtle shell on front and covering the organs. So it's going to run lengthwise. What I'll do for trigger points is I'm going to do movements that are going to be perpendicular to the muscle that are very slow and controlled once I find areas of tenderness or tension. Now I'll use two different tools. I will use a 4 3/4 massage ball. You can use a smaller surface area. I like to start with the broader surface area and release both the fascia and then find areas of tenderness. And once I do find those trigger points, so I live close to the coast, and there's shells that have been smoothed down. So I like to find these shells, and I'll use that smooth surface, and I will work my way across the muscle to find those areas, and then just hold for 20 to 30 seconds or even longer. If I feel the trigger point where it's radiating to other areas, I'll hold until that starts to subside, and that's a successful release of that trigger point. So starting with my 4 3/4 massage ball, I'm going to go onto my stomach. And first, you want to locate that rectus abdominis. So it is going to be on the front side of the abdomen, right in the middle, the linea alba. That's going to be a band of connective tissue that's pretty thick. And you want to go right over next to that, to the muscle, and just follow along that line. I'm going to start below my rib cage. I like to put pressure on the ribs. I like to come down to where I'm on the muscle belly. So that's where I start and just hold in that area. So I'm on the upper portion, and I'm just going to let my body weight sink down into that area. Once you can lie completely flat. You can, if it's tender or feels tense, you can hold some of the body weight onto your elbows and just start to sink down. And then work your way down towards the pubic bone. So down towards the bottom of your abdominal wall. And as you go, you just want to hold where you feel areas of either tension or tenderness. There's usually going to be trigger points in the upper portion or down in the lower portion. The upper portion is going to most likely radiate pain towards the mid-back. The lower portion is going to most likely radiate pain either to the front or to the lower back. but they can radiate around to the back side. So I'll just work my way down. And then you can go pretty low. So you can go all the way down to the very bottom and just hold and apply that pressure there. And again, this can also radiate pain towards the front side of the abdominal cavity if there is trigger points in that lower portion. And so you can just hang out here, release that tension, let that, you can maybe feel it soften or let go. And sometimes if something has been tense for a long time, it can take a few days, it can take longer to work on the fascial tension. The trigger points you may feel right away, and then you just want to let them subside. And then I can work my way back up. So I'm going to come right back to that first part, hold there. And then what I can do is I can just investigate going gently side to side. And that's going to go perpendicular to the muscle belly. So that's how I can use the massage ball to work on trigger points and fascia of the rectus abdominis. Then what I'll do is I'll take the shell that's got the smooth surface and I'll lie on my back, and then I'll start in that linea alba, that middle, and just kind of soft and gently apply a little bit of pressure and then just pull side and work my way down, just starting in that center and pulling to the side. And then if I feel an area that's tender or tense, I'll then sink down into that just a little bit more and hold there to release the trigger point in that area. And just working my way all the way down. And this is to be to your comfort level. So you're investigating your tissue and finding areas that may be culprits to any pain that you may be having in your mid-back, your low back, or in that lower abdominal wall. And then you can check the other side. So just working my way. And you want to go slowly. Sometimes you'll want to go real slow and then start to apply gently more and more pressure and see if you can find any areas that are problematic. And for the lower part, you can go below the belly button, working your way down, and see if you have any trigger points in the lower part of the rectus abdominis. So those are 2 tools that I will use to address the rectus abdominis. And again, this muscle can be a culprit for mid-back pain and low back pain. And it is sometimes missed because we think of back pain, it must be something in the back, but actually it can be coming from the front. After you release it, you can stretch it. And to do that, I will go into a press up position. And I want my hands out in front so that I'm not overly compressing my back, but I'm getting a stretch in that muscle. And then I'll look up and hold this for anywhere from 30 seconds to a minute. And what you're looking for is you're looking for that stretch through the rectus abdominal, the muscle that you just investigated, and release some myofascial tension. I hope this is of help and have a blessed day. Thank you.